In this recording, I'm actually want to discuss some structures associated with the spinal cord, but are not the spinal cord themselves, because they're going to be important for carrying information to and from that spinal cord, or when I talk about the meninges, obviously important in kind of protecting that spinal cord. So I want to look at this model, and we're going to, the spinal cord is right here. Okay, so showing you a section of the cervical spinal cord. But we're going to be looking at some of these structures kind of outside of the central nervous system first. So I just kind of want to remind you, okay, let's show you a different picture, and then we'll come back to this. This one I'm going to look at, is we have these structures I'm about to talk about, the dorsal root and the ventral root and the ventral and the posterior ramus. Posterior ramus can also be called the dorsal ramus, just so you know. Anterior ramus can also be called the ventral ramus. Is your ventral and dorsal rami are branches of spinal nerves, and they're carrying information to and from different structures. So the difference is the posterior or dorsal ramus is carrying information to and from the spinal cord from structures in your back, say skin in your back, muscles in the back. The ventral ramus is bringing information to and from structures in your limbs, upper lower limbs, and your anterolateral body wall. So these are mixed. These are branches of your spinal nerves. The spinal nerve comes through the openings between the vertebra, so-called intervertebral foramen. And the spinal nerve is when the dorsal and the ventral roots come together. So you see dorsal root, ventral root here. The dorsal root is not mixed. The ventral root are not mixed. The dorsal roots only have axons of sensory neurons, while the ventral roots only have axons of motor neurons. So these are going in this direction. This is going in this direction. The dorsal root ganglion, which you see right here, has cell bodies of sensory neurons. Okay, so these are all very important structures, but they're all part of the peripheral nervous system. A little heads up, the dorsal root ganglion is gray matter because it has cell bodies. All the rest of the structures that I've mentioned are white matter because they only have axons. They're transmitting information. Integrating information is where you have the gray matter. So let's kind of come back to this picture here, right there, and we'll look at those structures. Okay, so here and there is the ventral ramus. Okay, I'll put V for ventral ramus. There's the dorsal ramus. Those are branches of what you see right here is the spinal nerve. So those are the spinal nerves. They've opened this up so you can see inside. That's the dorsal root ganglion, but it's here too, kind of where it bulges. That's the dorsal root ganglion. I'm going to color in, let's erase this so you can see a little bit better. So the dorsal root, you see, is right here, coming up here, coming into the back. So there's the dorsal root. The ventral root, I'll do in green, is coming right here. It's coming away, it's exiting. It has axons of motor neurons. Also, I'm going to zoom in, and I'm going to talk a little bit about what you're seeing around that spinal cord. I'm going to zoom in, and let's talk meninges. So, spinal meninges. So we have out here, where you see the kind of that 9. It's a weird shaped 9. It looks more like a G. Out here, all this out here is the dura mater. That's the outermost of the meninges. The arachnoid mater is right underneath it. Okay? It's right there. The pia mater is right around the spinal cord. Okay, that's the innermost of the meninges. Okay, so remember we have meninges up in the brain, but you also have them in the spinal cord. Okay, see, these are spinal meninges. Well, we also have these spaces. Well, in the spinal cord, the space above the dura mater is called the epidural space. So right here, that's the epidural space. That is a real space. You see adipose tissue in there. You see large blood vessels. This is a site where someone has an epidural done. So if you're having a child and you didn't want to feel all that, they give you an epidural. Or some people have had epidurals just for pain relief. So they will inject the needle into there because of large blood vessels. In the brain, the epidural space is a potential space. There is no space between the skull and the dura mater, but in the spinal cord there is. Between the dura mater and the arachnoid mater, you see this line right there. That's the subdural space. That is a potential space. So the dura mater and arachnoid mater are right next to each other. That only becomes a space if you say, for example, damage, say, a vein, and you get an accumulation of blood between those two layers, which is not a good thing. Under the arachnoid mater, you have here, I'm going to do it in blue, just because there's CSF in there. So all of this, all in here, in there, that's the subarachnoid space. So I'm going to write up subarachnoid space. Subarachnoid space is filled with cerebrospinal fluid, which helps to nourish the spinal cord. It's also going to be important in the brain too. It's one of the things it does. But CSF also, though, is found right here in the center. That is the central canal. That central canal is continuous with the ventricular system in the brain. It's actually continuous with the fourth ventricle in the brain, which has CSF in it. Let's see. The pia mater, I do want to mention, the pia mater does have kind of extensions to it, and it's kind of hard to see in the model, but there's things that kind of come off like this that are referred to as denticulate ligaments. So kind of, I should say, the pia mater on either side of that spinal cord is thickened, and it forms what we call the denticulate ligaments, which help to provide lateral stability to the spinal cord, but it's a surgical landmark. Surgeons know if they see the denticulate ligaments, they're pretty much halfway between this dorsal root here and that ventral root right there. Okay. While I'm here, I do want to show you this here. This is the anterior median fissure. Back here is the posterior median sulcus, but I'm going to mention that again on the next recording, but that's what those are there, so you know what they are. I think that's all I wanted to do on this recording. So you should be able to fill in any notes if you have that goes off of these structures. Now these structures, again, are part of the peripheral nervous system, but they're still important in kind of connecting the central and the peripheral nervous system together. So it's important in the spinal cord.